Today, the world is battling a global pandemic, and there's plenty of work to do. Some needs are obvious, like developing medicines and vaccines. Some needs are less obvious, like finding a faster way to put those medicines and vaccines into small glass vials so every person in America can quickly get vaccinated. This task sounds simple, but it's surprisingly hard. America has 330 million people, all of whom will likely need 2 to 4 injections. That means packaging between 660 million and 1.3 billion doses of a vaccine, which requires an enormous number of glass vials and syringes. We have some of those glass vials and syringes in stockpiles, but not nearly enough. And it will take at least 12 months to get the needed amounts. We can't wait that long. And even if we somehow got all the glass vials and syringes, we will also need specialized filling machinery to fill all those vials. Again, we have some, but not nearly enough. And for guaranteed access, those filling lines must be located in the U.S. Unfortunately, most are overseas. These obstacles explain why America's Assistant Secretary for Preparedness and Response and the Strategic National Stockpile, both part of the U.S. Department of Health and Human Services, have teamed up with a U.S. company called Apiject Systems America to help package hundreds of millions of doses of vaccines and therapeutics fast. The partnership is called the RAPID Consortium. RAPID will build U.S.-based facilities to make a new kind of plastic pre-filled syringe at extraordinary speed. These facilities will make enough pre-filled syringes to inject every man, woman, and child in America with just the right dose 30 days after a vaccine becomes available. Plus, every pre-filled syringe can have an RFID chip attached. This will allow healthcare workers to use their mobile phones to automatically capture where and when every injection takes place, helping public health officials make more informed decisions. And to help make sure this vital national resource gets built on time, one of the world's 10 largest investment banks, Jefferies Financial Group, is raising $1 billion in capital. The secret of Rapid's filling speed is an FDA-approved aseptic plastic manufacturing process called blow, fill, seal, or BFS for short. It's the same process that makes disposable eye drop containers. Every year, BFS is used to package billions of doses of vaccines and medicines worldwide. Building the Rapid network would ordinarily take 3 to 5 years. But Rapid is finding ways to start making tens of millions of pre-filled syringes every month later this year. Rapid is what America and the world need, a public-private partnership that blends government defense expertise with private enterprise efficiency. I'm Jay Walker, the chairman of Rapid. Together, we will overcome this virus.
The world is confronting a public health emergency unlike any we've seen in over a century. We are facing a highly transmissible and deadly virus which not only claims lives but also disrupts the very foundations of our society. The American healthcare system is being taxed to the limit. Our economy is spiraling downward, and our population is being paralyzed by fear stemming from a lack of a coordinated response and a dearth of accurate, clear communication about the path forward. Our window of opportunity is closing. If we fail to improve our response now, based on science, I fear the pandemic will get worse and be prolonged. There will be likely a resurgence of COVID-19 this fall. It will be greatly compounded by the challenges of seasonal influenza. Without better planning, 2020 could be the darkest winter in modern history. 2020 could be the darkest winter in modern history. First and foremost, we need to be truthful with the American people. Americans deserve the truth. The truth must be based on science. We have the world's greatest scientists. Let us lead. Let us speak without fear of retribution. Initially, our nation was not as prepared as we should have been, as we could have been. Some scientists raised early warning signals that were overlooked, and pages from our pandemic playbook were ignored by some in leadership.
Global Preparedness Monitoring Board. And this is on their About page. What is the GPMB? The Global Preparedness Monitoring Board is an independent monitoring and accountability body to ensure preparedness for global health crisis. Comprised of political leaders, agency principals and world-class experts, the board provides an independent and comprehensive appraisal for policymakers and the world about progress towards increased preparedness and response capacity for disease outbreaks and other emergencies with health consequences. In short, the work of the GPMB will be to chart a roadmap for a safer world. Created in response to recommendations by the UN Secretary-General's Global Health Crisis Task Force in 2017, the GPMB was convened by the World Health Organization and the World Bank Group and formally launched in May 2018. There are a lot of big names on this board, and among them we find Dr. Anthony Fauci, the Director of the National Institute of Allergy and Infectious Diseases USA, and also Dr. Chris Elias, President of the Global Development Program, the Bill and Melinda Gates Foundation USA.